Good morning, everyone. My name is Neelam Trivedi, and today I'm going to talk about oral semaglutide, uh, which is also known as GLP-1. And here also we will discuss about the brand name Rybelsus, under which also, it is sold. So first, I would like to explain what is GLP-1 and why recently it has gained so much attention in the market by the pharmaceutical companies, scientists. GLP-1 has multiple advantages that it releases in the stomach. It is an hormone, peptidal, and it helps in controlling blood glucose level as well as obesity. It makes you feel full, so you don't overeat. It is the natural hormone produced by our body, but in some time it is not released properly in diabetic patients or in obesity or obese patients. Because of that, when it is taken through external route, it helps in reducing blood glucose level by controlling your appetite, your hunger. It is a potent 30 amino acid peptide, and it is secreted from the endocrine L cells in ileum and colon, and it restores the sensitivity of beta cells, as well as it induces beta cells to release insulin in response to rising glucose, and it suppresses the glucagon secretion. As well as there are multiple metabolic activity where it is involved. So first I would like to explain why semaglutide, how it got stuck into the mind. It was invented by AstraZeneca first. It was a long acting, approximately 2.5 hour. Its activity as compared to the regular GLP-1, which is produced by the body, it's for a few minutes. Then liraglutide was developed by Novo Nordisk. Later, GSK, Eli Lilly, Sanofi, even they have developed their own version. And finally, semaglutide was developed by Novo Nordisk, which is having a life of around 160 hours. And they developed by modifying by altering the GLP-1 by amino acid substitution, as well as tagging with the spacer and C18 fatty diacid chain in position 26. So also they altered so that it could not easily degraded by the DPP4, which is an inhibitor. But the main challenge is for oral delivery of GLP-1. The moment it is given through orally, because it's a peptide hormone, it gets degraded easily inside the stomach. And there was a painful injections. So now for the pharmaceutical companies, there were challenges to deliver it orally, because most of the diabetics, type 2 diabetes, or who required the therapy, GLP-1 therapy, they were reluctant to initiate it because of the painful injections. So pharmaceutical companies were very much interested to solve this problem, and then they came out with the solution. So Novo Nordisk, they collaborated with Allegiant, Hemisphere technology, snack-based technology, which is not only protecting the GLP-1 when it is given orally, but it also helps in the absorption of GLP-1 from stomach, and then it carries out its action. So they carried out the to find out that how the where it get absorbed easily, what is the dissolution time, and they for this they carried out the gamma scintigraphic image, and they found that a tablet, it takes roughly 140 minutes to dissolve completely inside the stomach. And they carried out two different study in a fed state and fasted state, and they found that in a fasting state, the absorption of GLP-1 is more as compared to the fed state. And they scientists were interested to understand where exactly the absorption process is happening, either in the stomach or in the intestine. So they found out that through splenic vein, the absorption is more, and therefore they concluded from the stomach, the absorption, uh, that is the where the absorption is happening more. That is a predominant site of absorption. So they concluded that the formulation tablet is GLP-1 tablet is stable. It is tolerant, tolerating the gastric pH and enzyme, biocompatible, and it is targeting the GLP-1 receptors in gut. So after clearing the regulatory, they entered into clinical trials of oral semaglutide, and in phase 1 trial was conducted with multiple dose range in healthy type 2 diabetic males, and they were able to find it out that 300 mg snack is the optimum dose for the formulation, and a human can tolerate up to 40 mg of GLP-1 through oral route. And in phase 2 trial, they were like future clinical trials should be carried out for a longer duration to see the good efficacy in the human being, how it is reducing the HbA1c level. So for how they selected the dose for phase 3 trials, what they did, they carried out the study in phase 1 and phase 2 till 40 mg, and through AI, with the help of AI, they found out that how it is seen after 20 mg, hardly any reduction in HbA1c is there till 40 mg. So they selected the dose from 1 mg to 20 mg with the help of AI, and 3 mg, 7 mg, and 14 mg were the selected dose for future clinical trials. The efficacy of oral semaglutide was checked in the healthy type 2 diabetes mellitus diabetics versus placebo in Pioneer 1 study. In Pioneer 2, semaglutide was compared with empagliflozin, and they found out that more 31% of patients have shown the diarrhea, vomiting, nausea, and there were two kinds of study: treatment policy and trial product estimate. And here they were able to see the good control of in diabetics, where oral semaglutide was given as compared to empagliflozin, while hardly it was showing in body weight control as compared to empagliflozin. Then they carried out multiple pioneer studies, and the efficacy of oral semaglutide versus placebo when it was added to insulin with or without metformin in type 2 diabetes mellitus, and they found out the difference between, it was a randomized double-blind study, and they found out that oral semaglutide was superior to placebo in reducing HbA1c as well as body weight. So the comparative studies of oral semaglutide with type 2 diabetes mellitus drugs were conducted in phase 3 trial, and it is not at all recommended as a first-line therapy for patients who are not able to control their glucose level through diet and exercise. And it has been found out that some diarrhea and stomach upset in patients. And because of that, few patients, they haven't continued the study. And it is not at all recommended for type 1 diabetes mellitus or diabetic ketoacidosis patients. And it is not a substitute for insulin. Insulin is very much needed in type 1 diabetes mellitus, or where in type 2 diabetes mellitus also, when it is not controlled. So there are instructions when to take oral semaglutide. uh, you have to take it after waking up in the morning, um, with a glass of water, approximately 120 ml. And after 30 minutes only, you can consume any other medicine or food for the better efficacy. And if the dose is also need to be increased, so it should be eventually like 3 mg. The first, yeah, patients need to start with 3 mg. Then after 30 days, 7 mg, and then subsequent 30 days, 14 mg, to see the efficacy as well as the adverse effect reaction. So oral semaglutide, it is launched in a 3-dose range, and it is required once in a day. It's a painless therapy, and patients' compliance. And thank you very much. I will be happy